Well, as part of normal aging, there are a few things that you can expect to see in terms of physical findings. Um, One thing that we see as old people age is that response time tends to be a bit slower. So that during the interaction in a physical exam, often we find that older adults will respond a bit slower than younger counterparts. This is outside of the context of there being neurological impairment or dementia, but just as part of normal aging. We need to account for that in our interactions. One of the other changes that we see is changes in muscle bulk, so that as people age, it's considered a normal part of aging that muscle bulk slowly decreases as people age. Um, we also find that muscle strength similarly decreases with aging. This is true even among healthy and active older adults. The other common change that we'll see as people age is changes in skin. So that in the older adult, you'll see a thinner quality to the skin that's a bit more fragile than that of younger adults. The skin also has a decreased elasticity, so that it doesn't have the tensile strength that a younger adult's skin might. This puts older adults at increased risk for things like bruises and skin tears, even when they're healthy.
Two ways to sort out whether the exam findings are a normal part of aging or whether they're an acute process is primarily to ask the patient, ask the family members, or ask a staff member at the facility whether this is a change in baseline. That can be one of your biggest keys to deciding whether this is normal for that patient or whether this is an acute change. The other is to examine the patient. If you have a concern about bruising, whether there's a potential fracture or other injury underlying, if it's not bothering the patient, a good rule of thumb is it's probably not acute, although that is not always the case.
One of the most important things for examining the older adult, in my opinion, is observing them. I think simply by watching the older adult and how they move through their environment, one can gain tremendous information about that individual's health status and function. So seeing how they walk in their environment can tell you a lot about their balance. It can tell you about their fall risk. Seeing how they communicate with others can tell you about their level of consciousness. It can tell you about their clarity of thought. These things can be tremendously valuable in putting together the package of how that older adult is doing. I think as a geriatrician, we think a lot about function. And the way that you best find out a person's function is to watch.
There are numerous physical exam findings in older adults that are cause for concern, and the possibilities are endless, so I'll just name a few. One that goes along with strokes is tearing in one eye. Now, if a patient just got something in their eye, or they have some kind of infection in their eye, that's a special case, but a stroke can present with patients tearing in just one eye. Some other physical exam findings are fever or rigor, which could indicate some kind of infection. And fever is especially useful in allowing us to help differentiate between different kinds of respiratory causes. Another physical exam finding that's important is sudden weight gain, because sudden weight gain could indicate that a patient's a high cause are likely to go into florid pulmonary edema. Another physical exam finding that's significant in elderly patients is unilateral wheezes. We often hear wheezes, but unilateral wheezes could indicate a foreign object in the lungs, could indicate some kind of tumor, or it could indicate some kind of pneumonia. So it's important that I think we take good lung sounds on both sides and in all lobes.